All right. Hello, and thank you, everyone. Welcome to the Flint Community Webinar, your community resource every Friday at noon. I'm Jennifer Edwards-Johnson, and I'm super excited to bring all of the trusted expertise that we have here with us today. We've got a pretty packed panel, and what I'm super excited about is we have the opportunity to bring to you some trusted research and evidence on some of the things that we discussed last week that there were questions about. So last week there were a few questions about COVID vaccines and risk of stroke and what we should be concerned about, and we've brought Paul Kilgore here to talk to us a little bit about that. Nurse T and Dr. Gordon are here to talk to us a little bit about health literacy and what it means to understand the health information that we're receiving. We've also got Jim Milanowski, President and CEO of Genesee Health Plan, and Patricia Franklin-Lindsay here to talk to us a little bit, who's coming from Huntington National Bank to talk to us a little bit about financial empowerment. So we've got a full packed schedule today, and we're so excited and thankful for our experts for being here with us to talk to community. I'd like to start by talking to Dr. Kilgore a little bit about what we should be thinking about in terms of vaccines and what we should be worried about and what trusted information that he wants the community to know. We can get Paul up here. Hey, Paul.
Hi. Sorry about that.
No worries.
Great to be here. I'm very excited actually to bring some new information, I think, that is really literally hot off the press. And if I may go ahead and share my slides, I'd like to go ahead and get them.
Absolutely.
Would that be okay?
For sure.
Okay. If you could just confirm that what you are seeing now is the title slide.
Yes, we see your title slide.
Perfect. Okay. So I know I don't have much time, so I'm going to be brief, but here's the good news. I do have a slide deck. I'm going to be happy to share with you all, and I'll make sure I send that across so that that's available to anyone. Okay?
Dr. Kilgore, you've got about 25 minutes, so I want you to get all the trusted information you feel like you need to get in.
Okay. So I'm going to hit on these things here today, and there's going to be a lot more background that I can also talk about and even answer some questions and do some answering in the Q&A later on. So let me go ahead and move right forward. Couple key points I want to make sure everyone knows about. COVID-19 is definitely still out there. It's a serious health threat in Michigan and around the US. I was just reading recently that we're now upwards of around over 20% still test positive. So the test positive rate is still substantial, and we may touch on that a little bit later. We do have data on the bivalent booster. This is the new vaccine, the latest vaccine version that we have. This is a booster that everyone should have, and you'll probably hear me repeat that. We want to use this vaccine to keep people safe, not only alive, but without complications from COVID-19 and certainly out of the hospital. There are some safety signal data that was presented by CDC, publicly released in early January, mid-January. There's some further analysis, literally from an FDA meeting just yesterday. It was a long meeting, but I'll try to distill out some of the key points from that meeting. And I have the link for that meeting if anyone wants to watch that on YouTube. There are some detailed studies that are being done. Some are ongoing right now using multiple data sources, suggesting that the Pfizer vaccine does not lead to increased risk of stroke. So I just want to put that out there right now. Getting the Pfizer bivalent COVID booster and a flu shot on the same day may raise the risk of stroke. This is still pending analysis. This association has not been confirmed and certainly requires further investigation. And there's additional study of COVID plus flu vaccine co-administration. So we'll be looking at those studies to make some determination or conclusion of if there is an increased risk of stroke and what to do about it and how to administer the vaccines. So the United States still has a huge burden. We've seen that burden continues. We're still seeing cases of COVID-19. You probably know people yourself who have had COVID-19. And certainly people who have passed away from it, which we really, in every way, shape, and form, we want to try to prevent. So in Michigan, this is just a couple days ago, reported 6,530 new cases of COVID-19 and 260 deaths. And this is just really over the past week. So we are still seeing very serious disease. And a lot of this disease is occurring in people who are either unvaccinated, have not gotten a booster, and or have underlying medical conditions that will put them at higher risk for complications and severe disease. Now, one of the things I think is important to note is that we follow these weekly trends. And when we look at the data, this was actually presented yesterday in the FDA meeting. Since April, and now this is going back into April of 2022, we have seen increased hospitalization rates, especially among older adults, and that older adult range rates 75 and over. So this is very concerning because certainly one of the things we want to try to avoid are hospitalizations in this age group, because once people in this age group get sick, complications are much more likely, and bringing them back to full health is very challenging. One of the things I wanted to point out too is that if we look at these different age groups, and at the top of the table here, you see these age groups. So this is under 2 at the far left. And then we have the 65 and older age group. So the good news is that you do see older folks that do have at least one dose. Many have completed the first 2 doses, that's the primary series. And then many have gotten 1 or 2 boosters. The number of people, though, or the proportion of people globally within the United States that have received the second booster dose is relatively low. And those that have received the bivalent booster is about 40% nationally. Obviously, we want to see this much, much higher in order to really protect people from the severe disease that they can get in the complications. So we have some room to go really in making efforts to increase coverage. Now, here's some good news. If you look at this table and just focus your attention, please, on this purple box here and the yellow box here, I'm really focusing our attention on the vaccine effectiveness. So the question is the booster dose effective in preventing disease, particularly complications, severe disease? Hospitalizations is a great outcome to look at. So that's what they did in this analysis. And what we know is that compared with people who are unvaccinated, the COVID-19 booster dose, this is the bivalent booster, is 72% effective. Okay. Now, if you had only gotten the first 2 doses, that primary series, you're talking now about a vaccine effectiveness of about 25%. And if you look at the confidence interval here, that's essentially as if you were not really vaccinated anymore, because the confidence interval includes 0. What this means in practical terms is that in order to get protected against COVID-19, you've got to get the booster. You got to get the bivalent booster, because we have this new strain, the new subvariants out there that the primary series will provide some protection against, but you got to have that extra boost to get the antibody levels up to protect against the new strains. So that's one of the key messages for today. The tracker Michigan, this is directly from the michigan.gov website, shows us that we have about 70% of the Michigan population who have received 1 or more doses. So you could say that's kind of good news, but that's just really 1 dose. I'm talking about 1 dose of the primary series. As I just mentioned, that primary series is not enough. If we look at the booster coverage in Michigan, if you look at the left-hand side here, the booster coverage for the general population 5 years and older is about 39%. So we still are missing about 60% of individuals in Michigan have not received that booster dose. Now, we do hope, if you look at the far right-hand side here now by county, the booster coverage, this is the percent of fully vaccinated with 1 booster dose, is about 60%. What we really want to see are people getting 1 booster or 2 boosters. And if you haven't had any booster, that's okay. Just make sure you go talk with your doctor and make an appointment to get that new bivalent booster. Now, this is Genesee County. I wanted to focus in on here because if you look at Genesee County, Right now, we're talking about fairly low coverage in Genesee County, so we have some room to grow there. I'm sure we're going to be talking more about this, but I just want to point out the opportunity we have for helping people understand the value of the booster and what it means for them in terms of protection against severe disease. So a lot more people can get the vaccine if they want. These data from the CDC website are very, very important, and the message is in yellow here. So folks who are 50 years and older with 2 booster doses were 14 times less likely to die from COVID-19 than unvaccinated people of the same age, and 3 times less likely to die than vaccinated people of the same age who had just 1 booster. So primary series and at least the bivalent booster is very, very important right now. Now, I just wanted to really distill this down too, to kind of talk about the primary series and booster dose, because it's kind of confusing, I think, for many people. And I just want to communicate this as simply as I can. The primary series can be given in 2 doses, should be given in 2 doses. That's what we've had for many, many months now. It can be given 4 to 8 weeks apart. The booster dose is required to maintain that protection, especially against the new strains. It's 1 dose right now. Potentially could get a second dose down the road, but let's keep it simple and say 1 dose. So an example of a series that someone who's unvaccinated would get would be a primary dose starting today, 2 months, a month later, February 27th would be their second dose. And then a few months later, 2 months later, would be their dose 3, that booster dose, the bivalent booster dose. Okay, that's what I would recommend for anyone who has not yet taken the opportunity to get vaccinated. Now, one of the things we learned in mid-January is that CDC observed a signal. This is an observation, an increased number of reports of a particular health condition following one or more vaccine doses. Now, the vaccine safety signal can be found in reports gathered across different databases. And this is information really focused on vaccine-associated adverse events. There's several databases that we look at. One is VAERS. And here I highlighted in bold, the Vaccine Adverse Events Reporting System. Another database that CDC maintains is the Vaccine Safety Data Link. Now, how do we assess vaccine safety signals? So we really look at these adverse events reported following immunization. They're collected jointly by CDC and FDA, so you have lots of people looking at the data, which is great. These reports are saved in an electronic database and they're analyzed. The computer data analysis is regularly performed, and these are by really experienced staff who understand how to run the programs, how to look at the data, how to synthesize it and analyze it to give some impression of what's happening. They have specific analytic techniques which were described in pretty good detail yesterday at the FDA meeting. I won't go into those today because they're pretty detailed and would consume more time. But the basic cycle that you see here of data analysis starts with the adverse events following immunization detection. They get notified to CDC and FDA. These are then reported, and we start an investigation if there's a signal. That investigation entails further data collection, data management, and then at the time that studies are done, more detailed studies are done, we do in-depth things like chart reviews, checking people's vaccination status, confirming what vaccines they got, what type of vaccines, even what manufacturer they got. And then we look to determine whether or not there's a clear association or cause between receiving the vaccine and that adverse event. So this deeper study is really looking at a signal, this observation of an apparent increase in the number of persons that were age 65 and older who experienced a stroke. And we're talking about an ischemic type of stroke after COVID-19 vaccine. This was observed in particular with one of the COVID-19 vaccine, that is the Pfizer bivalent booster dose. Okay, and the observation of the ischemic stroke signal was not identified following receipt of Moderna's bivalent booster. Okay, now let's talk about stroke just for a minute. It's a health condition where we restrict blood flow or blood flow is decreased to an area of the brain, either partially or completely. It's an area of the brain does not get blood, and when that happens, the function of the brain region declines or stops completely, the goal of stroke treatment is to help restore that blood-brain flow and to reduce damage to the brain areas that are affected by the low blood flow. And what does this look like in an ischemic stroke? The ischemia is really a restriction of blood flow. So that can occur in particular when we block an artery. So this happens even in the absence of many other things, but underlying etiologies or causes can be high blood pressure combined with diabetes, combined with high cholesterol levels, and even genetics can play a role. It's a lot of different factors, but the bottom line is it blocks blood flow and causes the brain function to stop or cease in that area. When we do further investigation of these signals, we look at one system that shows that signal, but we also want to look at other data systems that confirm that signal. And sometimes they do confirm it, sometimes they don't. Many factors can influence the occurrence of adverse events following vaccination, so it really requires deep understanding of the reports, really digging deep into the reports, which takes a lot of time. It's very labor intensive, which is why it takes time on the part of FDA and CDC staff. And using specific study methods like a case control design, we can actually identify the association between receipt of a vaccine, which would be the exposure, and the observance of an adverse event or an illness or health condition. And that's really what they did. The various data indicated that in 2022, there were 37 reports of ischemic stroke in older adults and 24 in people 80 years and older after receiving the Pfizer COVID-19 vaccine. This is the booster dose. The vaccine data does not detail whether the vaccine received with bivalent booster, the primary series, in the initial signal analysis. So that's why they dug deeper. The CNN did report out, they had talking with the CDC staff, and they learned by talking with the CDC staff that the vaccine safety data link also showed 130 individuals experienced stroke within 3 weeks after vaccination. So what does this look like in the data? This was presented yesterday. The YouTube link to the entire meeting is down in your lower left-hand corner, so you take a look at that. But you can see here this data showing a relative risk increase. A relative risk is really compared with the normal situation. Is there an increased risk of occurrence? And one of the things that you can basically see here is they compared the risk of a stroke in these older individuals who had gotten the Pfizer bivalent booster to individuals who had received the vaccine or no vaccine in a later time interval. So the concern in that signal that I showed you earlier, and I'll show you more data in a minute, was that people were getting the stroke early on within like 3 weeks after getting the bivalent booster. So that data suggested in the early analysis that there was an increased risk. And the signal that I'm talking about looks like this. You can see here these cases of stroke, increased reports in the time period since, and you can see here from day 0 after receiving the vaccine to about day 20 or 21. This is where this peak of the stroke cases occurred. And after that, in days after day 20, for example, this risk of the stroke, or the occurrence of the stroke, I should say, goes down. Okay. So one of the things they did after doing deeper analysis, they went into the charts, they went in to check the vaccine records, and they learned a couple things. One was that when they looked at folks that had received the bivalent booster and got the same, on the same day, a high dose or adjuvanted flu vaccine, those individuals were at twice the risk or 2 times higher risk of having an ischemic stroke compared with individuals that in the time interval later on in that day 22 to 42 period. So this is the comparison interval. That signal period is day 1 to 21. So that's the time period where we would be very concerned potentially that ischemic stroke may occur. Now, for folks that had received the bivalent Pfizer vaccine or a regular dose, standard dose flu vaccine, there was no increased risk of stroke. And similarly, people who just got the bivalent Pfizer vaccine without any flu vaccine were not at increased risk stroke. So I hope that that's clear. The real issue is those people who got the bivalent Pfizer plus the high dose flu vaccine. And really the high dose flu vaccine is meant for older individuals. These are also adjuvanted vaccines. This means that they have an extra component that helps improve the immune response in older people who need that. So then CMS and the FDA went into their databases, and the bottom line from their analysis so far is that they have not observed an increased risk of stroke among individuals who had received the Pfizer bivalent vaccine. So this is good news so far. More data is going to be coming out, more analysis is due, I'm sure. Here's kind of the bottom line from these studies so far. This study, looking at CMS data, this is Medicare data base, no increased risk of stroke. Also, the VA did their own analysis from their own database. Again, their data analysis showed no increased risk of ischemic stroke following receipt of the updated bivalent vaccine. The vaccine adverse events reporting system has not seen an increased risk of ischemic stroke following the updated bivalent vaccine. The global safety database that Pfizer maintains, they have also not seen a signal for ischemic stroke with the updated bivalent vaccine. And then other countries, for example, Israel, have done data analysis of the vaccine, and we have not seen an increased risk of ischemic stroke with the updated bivalent vaccines. So here's a key question that you're probably wondering. Should we still consider getting a COVID-19 vaccine and a high dose or adjuvanted flu vaccine together? So what I'm going to tell you now is that CDC and FDA are still working on their analysis around this question. There's no change in the recommendations from CDC issued at this time. It's possible that both the receipt of both a Pfizer bivalent COVID-19 vaccine and a high dose or adjuvanted flu vaccine on the same day in people 65 and older may increase the risk of an ischemic stroke. The jury is really still out. The mechanism by which this might happen in those who may be at risk for this rare occurrence is not known, but it may be related to the immunologic response and inflammation stimulated by the simultaneous receipt of these two vaccines. So let me summarize. The analysis is ongoing. Right now, it's safe for older adults to get the booster vaccine. I strongly recommend this. This is the bivalent booster in particular. Individuals who have underlying medical conditions that are at increased risk of COVID-19, including severe COVID-19 and flu. We know this has been going on for years. The risk of flu in older adults is huge. We're seeing tens of thousands of hospitalizations and several thousand deaths each year due to flu alone. So these individuals should still make an effort for sure to get their vaccines updated, especially the COVID-19 bivalent booster. And I would start with that one for sure. And if possible, consider separating your receipt of the Pfizer COVID-19 booster and your flu vaccine by at least 4 weeks. This is not a CDC recommendation. I just want to be very clear on that. This is just my personal recommendation. And there's clearly no recommendation right now around this, but stay tuned on that. I do have a couple action steps to recommend because I know this can be often lost in the kind of din of noise that you hear. If you've never received a COVID-19 vaccine, please start your series. It can help keep you alive, avoid serious complications, and keep you out of the hospital. Check your COVID-19 vaccine card if you have one. Review it with your doctor and pharmacist. You may be eligible for this COVID-19 booster dose right now. So also get your annual health checkup as soon as possible. Make sure you're checking in with your doctor or your clinic or pharmacist to get your blood pressure checked, and make sure you have that under control. Managing your blood pressure is so important. And I can tell you people are walking around right now not feeling any symptoms, but they have high blood pressure or hypertension. Make sure to talk with your doctor also about controlling diabetes, high cholesterol, and these other risk factors that put you at higher likelihood of having a stroke. You want to be able to avoid the stroke at all costs. And I have neighbors and friends and family who have had these even recently, and I can tell you it is devastating. So watch your diet, exercise, stress reduction methods, and if needed, drug therapy can help as well. Here's a link for questions, more links down at the bottom, and I'd be happy to share these slides again. Here's the link to more data. I just want to thank you very much, and I have lots of extra slides that follow this, but I'm going to stop right there for now. Thank you very much.
Thank you so much, Dr. Kilgore. I appreciated your last point. That was, if you have the opportunity to separate your flu from your COVID by 4 weeks, that although it's not a CDC recommendation, it is something that might make good sense for you and the decisions that you have to make for your own personal health. And I appreciate that because it highlights the importance of having these conversations with your physician, right? Is them sort of understanding your own personal risk and being able to take that data and sort of be thoughtful about it in conjunction with you about what your worries are and what your risks might be and what we need to be thoughtful about. And I was thinking as you were showing the data, like that was probably what my recommendation would be in the office is if you can, we don't know that there's a risk. We're still waiting on the data, but let's be pragmatic. And if we can, we want to keep you protected against both, but separate them a bit, right?
That's perfect. You nailed it. Absolutely. Yeah. I think that's exactly the message. And I think the other thing that people should feel is empowered to talk with their pharmacist or doctor.
Yep.
It is your right. And it's their job to listen to you and to listen to your questions in particular, and to make sure that you get the answers to your questions so you feel comfortable in doing what your action steps are. You know, I think that's so important nowadays. And if you're not getting listened to, give me a call. We'll find someone or talk to anyone on the panel. We'll find someone who will listen to your questions. Okay.
I love that. If you're not getting listened to, we're calling Dr. Kilgore. That's how that works.
You got it.
Dr. Gordon and Nurse T, I know you're out in the community. If you have any, I know Dr. Kilgore had a hard stop at 12:30, so many people need and want his expertise, but I think maybe we have time for one question or so from the community.
Hi.
Oh no.
We're echoing.
Oh, I think Dr. Gordon is still on from a different device.
Can you guys hear us?
There you go.
Okay.
All right.
Okay, there we go. So, one of the questions that I have, which you did address, because of the increased risk of strokes, making sure that we're actually in the community educating on signs and symptoms of stroke so that people can be familiar. Because I know a lot of times people will hear that it increases strokes or the risk factor, and then they will be afraid. So I'm very glad that you made that point. And also it gives us an opportunity to really educate more on the BFAST and empowering the community to know signs and symptoms, so that if they take the vaccination, their level of comfort can be that they are familiar with the signs and symptoms of stroke, and that they can get to the emergency department timely to have that safely treated. So I do appreciate that, as well as not getting the recommendation, even though I know it's not governed by CDC, but the recommendation of not getting both the flu vaccination and the vaccination on the same day. I always, empowered people to be mindful of that. Only my reason is because if I take both of them the same day and I have a reaction, I won't be able to identify which one I actually had a reaction to. So I do appreciate the presentation. Thank you so much.
Excellent point. Thank you very much. I really appreciate that. And that's a really important point. So fantastic. Thank you.
And I just had one question. Another thing is swirling around about annual COVID vaccines, like yearly. A lot of people have been asking about after they receive their booster, when will I need another one, or I'll need this every year. So I know that's kind of in the works with the FDA and the CDC, correct?
Right. Yeah. In fact, I'm going to guess that next year we're going to see a recommendation, or even later this year, for an annual vaccination for COVID-19. And when we look at the data, we see a waning immunity that does occur some months after receiving even the booster. And right now we are working on what you might call a lifelong COVID-19 vaccine and even a universal COVID-19 vaccine. That's something that is in the works, and a lot of people are researching that right now. Right now, I think the plan would be for the annual booster, and I plan to get it. I've looked at my card recently. I've gotten 5 doses of COVID-19 vaccine, and I'll probably go for the booster as well. In fact, I'm sure I will next year. And especially if you have anyone who's younger or older around you. In my case, I have my father around me is 93 right now. So I think that making sure you provide that protection for yourself and people around you is a great thing.
Thank you.
One more thing, Dr. Gilgore, I was thinking when you was talking about the physicians and residents going in and communicating to physicians, I think it might be an opportunity for us to start a movement with our physicians and bringing them in and just having them say, you know, that I'm committed to answering your questions, because a lot of times we talk about physician involvement and community engagement, but then sometimes physicians are so busy that they don't have that time. But I think that if we can have more physicians come on, and the more that the community hear that they are receptive and that they are welcoming, you will have more community residents, and that will build partnership with physicians and community, and we'll definitely have better healthcare outcomes. So thank you for publicly stating that commitment. I'm sure that it just increased a lot of community residents' comfort to be able to go to their physician.
And
Absolutely.
pharmacists.
Thank you.
A shout out to you, Dr. Kilgore. I know you have to go, speaking of busy. So thank you so much for sharing your time and expertise with us. We really appreciate it. And we'll
All
certainly
so
be
much.
asking you. Yeah.
Look forward to seeing you again soon. Thank you.
Yes, and we'll be asking for your expertise soon, I'm sure. Thanks
you.
again. All right. Sort of in line with this discussion, right? We've talked a lot about COVID vaccines and what to expect, and Dr. Kilgore has given us really, really helpful, great information. I want to go next to Matt Peters so he can tell us a little bit about what COVID-19 is doing in Genesee County and what we need to be thoughtful about. Matt, thank you so much.
Hi, yeah, thank you. Thank you for having me, Jennifer. Excited to be here.
And I didn't introduce you. You're from Genesee County Health Department. We got to always talk about the health department and our wonderful, trusted partners in the health department whenever we can. So my apologies.
Well, we really appreciate it. Yeah, my name is Matt. I'm an epidemiologist at the Genesee County Health Department. Just here to give a quick update on the state of COVID-19 and its incidence in the county. Relatively speaking, Genesee County is in pretty good shape at the current moment when it comes to the number of COVID-19 cases we're seeing. Our current case rate per 100,000 population per the CDC is around 59 cases per 100,000. We're seeing around 3 new COVID admissions per 100,000 to the hospitals, and around 3% of staffed inpatient beds in our hospitals are being taken up by patients with COVID-19. So those metrics altogether put us in a low level of community spread by the CDC's metrics. And just to give you a reference point, us being at around 59 cases per 100,000 population right now compares favorably to earlier this year. The highest number of cases per 100,000 that we've seen was back in May of 2022, and that was up at around 260 cases per 100,000. So we are lower right now, and we have seen a slight decrease in the number of hospitalizations just in the last couple of weeks. That does always come with a caveat, though, that being while we are at a relatively low state, the number of COVID cases we're seeing isn't at zero. Like I said, we're seeing around 59, 60 cases per 100,000. It's been a long time since we've seen our number of COVID cases truly drop to a level where there wasn't community spread. And the other caveat is that, of course, as we've seen throughout the course of this epidemic, things can change relatively quickly as well. So because of that, we at the health department always recommend following the CDC advice when it comes to getting vaccinated when you can, maintaining masking and social distancing when appropriate, monitoring yourself for symptoms, and making sure that you're keeping yourself and those around you safe. But as it stands right now, we are in a pretty good spot as far as spread goes relative to what we've seen before.
Matt, that's super helpful information, because I think part of understanding your risk, and you said mask and social distance and situations that make sense, and part of understanding what situations make sense means understanding what your spread looks like, right? When there's high community spread, you might be more thoughtful about whether you're dining into restaurants or whether you're engaging in sort of what we would consider more high risk activities. When there's lower risk exposure, having that data helps us make decisions about what sort of things we might want to engage in.
Yep, that's right. Yep, we at the health department try to follow the data as closely as possible and base our decisions off of that.
Yeah, well, we certainly appreciate all the work you do and all the time it takes to like collaborate and get all of this data together. And we appreciate you coming on the webinar to share that information with us. We're going to pivot a little bit. Thank you so much. And we're going to pivot a little bit to Nurse T and Dr. Gordon, who are going to talk to us a little bit about health literacy. And I think it's a really relevant topic because we got some really like hard numbers on COVID data, right? But what happens if you don't know what to do with those hard numbers and that COVID data? Or what if your doctor tells you something and you don't quite understand what that means for your life, right? Someone could say, yeah, the risk of having the flu vaccine and the COVID vaccine at the same time increases your risk of stroke in some people. And you might sit there and say, am I some people? Like, does that mean me? What does that mean? So here to talk to us a little bit about health literacy and why it's so important, we've got Dr. Gordon and Nurse T, who are going to talk to us a little bit.
So Dr. G is going to talk to us about what is health literacy. She put a PowerPoint together and she's having a little technical difficulties.
Okay. Hello, everyone. Today I'll be talking about what is health literacy. The goal of talking about health literacy is how to equip you, define health literacy, discuss and explore ways to improve health literacy in our community. Okay, let's get a little closer. Sorry. Okay. Diving into health literacy. Based on Healthy People 2013, health literacy is defined as personal health literacy, which is the extent to which individuals can identify, understand, and utilize information and services to the information decisions to make better actions for their health. Organizational health literacy is a degree to which organizations equally or equitably enable individuals to find, understand, and use information and services to inform health-related decisions, actions for themselves and others. It's Healthy People 2023. Now we have health literacy versus literacy. Literacy is basic reading, writing, and numeracy, or numbers, skills, no matter the context of the information. Health literacy can be defined as basic reading, writing, numeracy, communicating, understanding the healthcare context. Next slide, please. Now, we want to talk about, all know about in the healthcare, universal precautions. When we create barriers between ourselves and the ones that we care for to protect them from if we have something and if they have anything. So now when we talk about health literacy, universal precaution, we're taking down the barrier. We're going to assume that everyone has difficulty comprehending health information and accessing services. We're going to improve written patient education materials, signage, enhance patient empowerment, and self-management, such as medication management and support systems. Even patients who typically do not struggle with information may have experiences, challenges through situations, factors, such as emotional stress of a new diagnosis, a rare condition, or serious or complex healthcare issues. Why do we have, now we come to the why. Why do we have an health issue with literacy, health literacy? When people are looking for knowledge, when we're looking for knowledge and trying to understand things and having a discussion with someone, when organizations or individuals create or provide information that's too complex or too difficult to understand, we create health literacy. When we expect people to understand or ourselves understand what's complex or unknown and even contradicting things. A lot of times, even through COVID-19, people found with the constant influx of information, it was contradicting itself, people were saying. But we were telling them, well, as science comes along, COVID-19 is new to us and new things are coming along. And such, we get new information, we update it weekly and daily, and we give that to you. Now, the 3 A's, making sure information is accurate, accessible, and actionable. Not just giving you information, but we provide you information. What do you do with this information? Just like today, we talked about the updates on the COVID-19 vaccination, and wonderful PowerPoint explained to you when to get your COVID vaccine, when to get your booster, and if it's feasible to do your COVID and flu vaccine together. So we can learn together in the community. So when you go to your physician and they're speaking to you and you don't understand, sometimes, even it doesn't matter where you are at, you can have a PhD and you can go to your physician and, like you say, you're nervous because everyone gets nervous when they go to the doctor. You get a diagnosis, or you need to cut back on the salt, or you might be pre-diabetic or blood pressure, and like, wait a minute, what does this mean? And because your mind is racing for all these different scenarios, you're not taking in the information. So having your physician or your provider slow down, and if you have questions, take a notebook, bring someone with you that can also go over it with you, because a lot of times you say, well, I'm going to say this when I get there, and then you forget. So having that information handy will also help with health literacy. So health literacy is what we do in the community by providing information. So if you have any questions, just feel free to ask us. But health literacy is a big thing when we're out there with COVID-19. We call ourselves the COVID-19 Mythbusters. So
I love what you and Nurse T are doing in the community around health literacy, right? I think this conversation is so important. So we normalize the idea that all of us get nervous when we,
yes.
It makes me sad that people are nervous when they come see me, but I understand it, right? Even when I go to the doctor, I'm like, I hope I'm doing a good job, right? Like, I hope I did what I was supposed to. I hope I'm on top of what I'm supposed to be on top of. So there's that idea of wanting to be in good health, right? And not wanting to hear that there might be something wrong. And I really appreciated how you described that, right? When we think there's something wrong, our mind starts racing. Mm-hmm. We tell people a lot, right? You said bring a notebook. Oftentimes you might bring a colleague or a friend or a family member so that, they hear everything you didn't hear while your mind was racing, right?
Exactly.
So go ahead, Nursey.
And one thing too about health literacy is very important for the community to know that it gives them the empowerment and the accurate information that they need to make well-informed decisions. When we look at the disparities and everything that's going on, we create a disparity by not everyone receiving the accurate information and the same information so that they can become better versions of themselves. So one thing that's important is that we empower our community, we educate our community, but also is that when the community receives this education, that we be receptive. Because a lot of times when community come to healthcare providers, they may speak in layman's term, but the more we educate and the more they start understanding medical and professional jargon, and then we can't be intimidated or get, offended by that. So we just always have to make sure that we are doing whatever we can for the good of the community, because the goal is to advance healthcare outcomes, patient satisfaction, and to reduce some of them readmissions that's constantly coming to the hospital so that they can have better healthcare options.
I love that you said the word empower, right? You should feel empowered to ask questions when you are unsure of what's going on with your medical care. If you're unsure of the next steps, you should feel empowered around sort of all of your healthcare goals. And I love the word empower because it also brings us to our next guest, right? It leads us right in. So thank you, Nurse T. We really appreciate you. It brings us right into Jim Malinowski and Pat Franklin, who are going to talk about emPOWER Genesee and financial growth. So super thanks to Nurse T and Dr. Gordon out there in the community doing that amazing work. And a super thanks to you to Jim Malinowski and Patricia Franklin Lindsay for talking to us a little bit today about the resources that they have in emPOWER Genesee.
Dr. Johnson, I had a perfect segue with all that. And you stole it from me. 'Cause
That's
each
my job.
speaker used the word empower. So yes,
Oh.
I don't know if my slides dealt perfect. So I want to talk in the last few minutes here about a real special program. And we use the word emPOWER Genesee. Next slide. And this is a real, we worked in this webinar and we talk in this webinar about working collaboratively. And I can't tell you of a more wonderful project that I've been involved with at the Genesee Health Plan as emPOWER Genesee. Organizations including Ascension Genesis, Consumers Energy, Huntington Bank, and Genesee Health Plan got together to really address a big need in our community. And again, that's a real public-private partnership. This is a way it should be done in our community, in our city, in our state, and in our country. And so this is a good example of that working. It's really coming together to address those social issues, those influences that impact health. And so it really funds a health navigator to really look at health, energy, and financial literacy and financial assistance. Next slide. So from the consumer's energy perspective, they have a lot of folks that struggle paying their utility bills as those get higher, especially during the summer. A lot of people get behind on those. And how do they get those resources that might be available out to people? Next slide. Ascension Genesis has many people who live in our community in Flint that really need assistance. They might have health insurance, but they really need some assistance either getting to the doctor's office, establishing that primary health home that we've talked about so many times. And so many people struggle just with, and then also a lot of their patients have all these other needs, food, clothing. And so that's what they were looking for when they came to the table on this project. Next slide, please. And Huntington does a lot in our community. They really want to serve the underserved areas in our in our area, in our region, in our city. And so their goal is to improve financial literacy, because there is a link between if someone is not doing well health-wise, chances are financially, obviously, they're not going to do well, and they struggle. And there's so many issues out there like credit and banking and all of those things that a lot of the same people who have issues in health and utility assistance also need help with their finances. And so Huntington Bank really is a key partner in that. Next slide, please. So in 2019, we all came together. And what's interesting is there is the Consumers Energy Payment Center on Court Street. Many of you probably know where that's at. And when we first were looking at this project in 2017, 2018, Consumers Energy kept telling to me, there's 10,000 people a month that go to pay their utility bills at the payment center. And the same group comes basically month after month. And I actually didn't believe them. And I had to see for myself, and wow, same people go month after month, and for a variety of different reasons. Some of them are just social. They're used to going. They don't trust online banking like many of us use. They don't have a bank account. There's a lot of reasons why people do that. And so this was decided upon as a perfect location to have a worker, because wow, you don't have to make calls. You don't have to get in your car and go over town trying to assist people. They're all there in one place. And since then, we've also opened up this partnership with the Ascension Genesis Clinic downtown. There's one right there on Saginaw Street. There's also a Clio safety store up in Clio. And so in the northern areas of of the county. Our worker goes out there once a month to help people in this program, as well as a kiosk set up with our friends at R.L. Jones Community Center and Mother Jones and her project up there. So we really want to make sure people have access that normally would have a hard time getting to places or reaching all of these different areas. They can all do it in one spot or in talking with one person. Next slide, please. So our community navigator is funded by all these partners, and they help with a variety of different things. The Flint registry, helping people enroll into that, food and clothing assistance, making sure people are enrolled into healthcare, whether it's Medicaid, Medicare, the Affordable Care Act, other referrals like housing, but the biggest one, and transportation as well. Biggest one though is utility assistance, whether it's through the state emergency relief program or through consumers programs that they have for people. There's a lot of folks in our community who need help with utility assistance. So our navigator is trained in all of this, and they can help with helping somebody in any of these areas. Next slide, please. So this is where the payment center is on Court Street. I'm going to quickly go through that. So next slide, please. This was the grand opening a few years ago. It was exciting. Just want to tell you the depth of our assistance. So we assisted close to 700 people in 2022, 1,700 initial and follow-up calls, and then some of the same folks give us a call a few times. And so we assisted with 456 state emergency relief applications. We submit them through the Michigan Department of Health and Human Services. And then all these referrals, whether they for utility bill assistance, clothing, food, daily essentials, housing, and then certainly a need for mental health, substance abuse type of counseling and medical care help. Next slide, please. So just a couple success stories, and then I'm going to get and turn it over to Pat from Huntington. Again, this is a typical example. Someone was just released out of prison, got COVID. This was a year or two ago, and was hospitalized at Ascension Genesis. Their employees connected that person to our emPOWER navigator. We were able to get their Medicaid turned on and approved with the help of our DHHS worker, and also was able to get food assistance, food stamps, food assistance programs right away. So that person went from jail not being connected to anything to getting Medicaid, getting food stamps. That's one of the examples of this program. And then the next slide. And this one's just about getting a medication. They were on Genesee Health Plan, but needed a medication that wasn't covered by Genesee Health Plan. And this navigator, again, was able to assist. So a variety of different reasons how we can assist. Next slide, please. I'm going to turn things over to Pat, because one of the things that Huntington has done is really brought this financial literacy. Nurse T and Dr. Gordon talked about health literacy. It's also important about having financial literacy. And so I'm going to turn it over to Pat and have her explain. We had a class at our location at Genesee Health Plan yesterday. Was wonderful. I'm going to turn it over to Pat, who led the class, and let her talk a few minutes about those classes and how important they are, and what we're going to talk about in the next few weeks, and how we can get people into those classes. So I'm going to turn it over to you, Pat.
Okay, well, thank you. Everything that you guys have said today is just, everything combines together. Health and education is such an important thing that we need to have. And again, like Jim said, if you're having some health issues, you're probably having some financial issues as well that goes along with that, or sometimes maybe the financial issues are causing some of the health issues that you may be having. So what we've done in partnership with emPOWER Genesee is did a fresh start workshop. We're doing 3 series. We had the last one just this past Thursday. We had an awesome time. It was very engaging, very, very knowledgeable, but it was to help people get a kickstart for the year, you know, how to get budget, how to put a purpose to your money. And coming up on the next class on Thursday, this coming up Thursday, we're going to be talking about credit, the importance of credit, how to maintain it, how to start it, and how to fix it. So we get a lot of questions about that. We all know that credit impacts so many different parts of our lives. So we want to make sure that everyone understands how to be able to start credit. So if you have young kids that are 18, starting college or just getting out of high school, they need to know how to get their credit started and what to do and how to do it in a healthy way. If you got credit, you know, and you may have messed it up, and or you need to have some help at paying off things, we want to be able to show you how to pay down debt, what is a good way to do it, how to be able to navigate the system, maybe negotiate through credit card or other payments. So hopefully we're looking forward to seeing everyone come out this Thursday if you can. The last section will be on being banked. As someone spoke earlier, there are a lot of people that are in our communities that are not connected to banks. So how to be banked. We want to show you how to use different tips and tools for saving, and most important, how to value your money so that you can set goal and purpose around it, so that you can meet your financial goals and achieve what your dreams are. So in these 3 classes, it's going to build, each class will build so that by the end of the class, you will have something to walk away with. You'll have a plan to walk away with. You'll have goal and purpose, and hopefully being able to move forward with the rest of your life. And we do have other partners and resources that will be there as well. They can help you if you need hand holding as far as being able to work through credit issues. So we're looking and hoping that everyone can come out. It's not just adults. If you have young adults, this is great information for them as well. And we look forward to seeing everyone. The classes are going to be held at Genesee Health Plan on Linden Road, and Jim can give you the address and the time.
If you can go to the next slide, I think there's some detail on all, there's some pictures. Yep, right there. So that tells you the classes. Our classes at 2171 South Linden Road. We're between Gordon Food and McDonald's. And you can either call us at 810-232-7740 to get registered, or there's that little fancy QR code that we're all kind of getting used to now. And you can take a picture of that and you can go right to our website to enroll that way as well. But again, very excited. It looks like there's some information in the chat about how to connect with this as well. Yeah. Free lunch, gift cards for participants, drawing for those, free transportation from MTA. If transportation is a barrier to get to the class, you can we can connect you to MTA and they'll give you a free ride to the class.
I love this so much. I think oftentimes we don't consider how, you know, trouble with resources, trouble with financial resources, trouble even with basic utilities can really impact people's healthcare. And, you know, what happens, it comes into our office, not all the time, but you know, with some regularity. You know, someone is a patient who has diabetes, and maybe they have trouble with getting their insulin, right? Or they need their insulin refrigerated and they're having trouble paying their consumer's energy bill or their electric bill or whatever it might be. And we don't always make those connections. So it makes sense, and it makes so much sense, and is so important that we've got these community connections, these community partnerships, both with understanding what resources exist in the community and that we can leverage for people. We have so much thanks to you, Jim Milanowski, and you, Patricia Franklin-Lindsay, for all of your support and the resources that you provide to the community. I'm excited, and I hope people get out so that they can tell their friends and they can tell other people who might need these resources to take advantage of them. Thank you so much for your time and attention and expertise and sharing of resources today. We really appreciate it.
Thank you.
I want to say, yeah. Thank you. I want to say a big thank you to all of our participants and all of our guests today. Big thank you to Paul Kilgore and his really timely, helpful information on when you should get your flu shot versus when you should get your booster. That's really helpful and important information. A big shout out to Dr. Gordon and Nurse T for talking to us about health literacy, and for our team from the health department for talking to us about COVID data. We can't wait to see you next week. Again, we're going to show you this slide that gives us your resources for how to get community health credit. We can go to that slide in a second. And thank you so much. We'll see you next week.
Awesome.